Chamberlain. I'm the digital director for BBC Media Action in India, where I've been leading BBC Media Action's digital work for more than a decade. BBC Media Action is the BBC's international charity. We believe in media and communication for good. Last year, we reached more than 130 million people in some of the world's poorest and most fragile countries. Our projects and programs save lives, protect livelihoods, counter misinformation, challenge prejudice, and build democracy. In India, in collaboration with two of our community partners, Chaitanya Wise and Pradhan, we have been exploring how to accelerate women's digital adoption in self-help group federations in the state of Madhya Pradesh. More than 82 million women in India are members of self-help groups, so the scale of the opportunity is significant. This work has been undertaken as part of the Digital Women's Economic Empowerment Project, a 3-year research and learning grant from the Bill and Melinda Gates Foundation to identify if and how digital technologies can accelerate and enhance pathways to women's empowerment in collectives without making existing inequalities worse. When designing digital solutions in contexts where there is a significant gender digital divide, for example, in South Asia and Sub-Saharan Africa, it's critical to adopt a gender-intentional approach. Melinda French Gates has defined gender intentionality as identifying and understanding gender inequalities, gender-based constraints, and inequitable norms and dynamics, and taking steps to address them. So why does gender-intentional design matter? To quote Melinda French Gates again, development projects that ignore gender inequalities usually fail to meet their objectives. USAID concurs that programs that incorrectly make the assumption that their users or beneficiaries have the required digital skills may set themselves up to fail or deepen the divide between the digital haves and have-nots. The figure on this slide depicts the 5-stage human-centered design process that was first pioneered by the design school at Stanford University. BBC Media Action successfully adopted and adapted this approach in India to create one of the largest mobile health communication programs in the world, Kilkarian Mobile Academy, which we transitioned to the government of India and their domestic partner, Arman, in April 2019 after scaling to 10 million women and 300,000 frontline health workers. You can read about how we did this in an article recently published in a special supplement in BMJ Global Health. We've spent the last 12 months using this same methodologies to iteratively co-create an intervention to reduce the gender digital divide in India. In the first step, we conducted literature reviews, key informant interviews, and quantitative and qualitative phone research with women in self-help groups during the pandemic to identify digital use cases that they found relevant and compelling, and to understand barriers to and triggers of change, including the role of gender norms in preventing women from using and owning mobile phones. The outputs of this discovery phase were 3 reports. These look at the scale of the gender digital divide in India, where only 26% of women own smartphones as compared to 49% of men, and its causes, why most digital literacy interventions in India have so far failed to reduce the divide at scale, and which approaches show the most promise, and the relationship between social network expansion, growing gender empowerment, and increased digital access and use in women's empowerment collectives, including self-help groups. All 3 reports are available on BBC Media Action's website. We analyzed the results of all of this research to co-define a theory of change for how women in self-help groups who already own mobiles, i.e. digital champions, could support other members in overcoming normative barriers to digital adoption by using digital job aids, including a WhatsApp chatbot, to play social and behavior change communication content to women in existing self-help group meetings. And that content establishes the value proposition for women's use and ownership of mobile phones and addresses safety and privacy concerns. It acts as a stimuli for group discussion, followed by the digital champions demonstrating different digital skills and leading group learning and practice. In the next phase of the project, we built prototypes, including the WhatsApp chatbot job aid for the digital champions. The objectives of the chatbot are to train the digital champions themselves, to provide easy access to social and behavior change video content to the digital champions to play in the group meetings, to guide the digital champions through a structured learning session in the group meetings, and to provide system-generated data, i.e. bot logs, to support the self-help group federations in monitoring and supervising the work of the digital champions. We created a brand for the intervention and the WhatsApp chatbot called Phone To Utao, which means pick up the phone in Hindi. To humanize the chatbot experience, we created a fictional narrator of the chatbot called Kushi Didi, which means happiness sister in Hindi. And working with our WhatsApp business solutions partner, IMI Cloud in India, we designed and built the chatbot using their award-winning platform. You can see screen grabs from the chatbot here. In step 5 of the process, as the SHG federations began rolling out the intervention, including the WhatsApp chatbot, we began to iteratively test all aspects of it with digital champions and women in self-help groups, including pre-testing all the chatbot content and usability testing the chatbot conversation flow. This involved A/B testing of different navigational approaches, menus, text, and graphics. In total, we conducted more than 300 in-depth tests over the course of 5 months. We also continuously analyzed the system-generated data, i.e. the chatbot logs, cross-referencing it with monitoring data captured by the SHG federations. On this slide, you can see a chatbot conversation flow diagram that shows the 3 different navigational approaches and menu approaches that we A/B tested as part of our gender-intentional, human-centered design process. I don't have time to share all of our learning with you today, so I'm just going to share some key insights from what we've learned about designing WhatsApp chatbots that women in low-literate, low-income contexts can use. We identified that iterative, task-based usability testing of chatbot conversation flows, including A/B testing of key navigational elements, is essential to improve navigability. Just as we learned back in 2012 in India that women in low-literate, low-income contexts couldn't navigate complex IVR menus, we discovered that conversation trees in chatbots needed to be replaced with linear navigation to improve usability. We also learned that even women with a secondary school education in self-help groups in Madhya Pradesh struggled with typing on smartphones and switching between text and number keypads. It's therefore advisable to minimize text-based user inputs and to use WhatsApp's quick response buttons instead to improve navigability. We A/B tested 3 different approaches to menus and learned that WhatsApp's list view menu with radio buttons is currently unfamiliar and confusing to new users of smartphones, and that text-heavy menus in session messages aren't read or understood. Instead, simple graphical menus that require Just a one-number text input were the clear favorite with women in terms of ease of use. Like the majority of internet users, text is scanned at best, and too many session messages are overwhelming. We ended up consolidating almost all of our text and images in WhatsApp's highly structured message format, i.e. HSMs, to increase engagement and ensure correct sequencing of communication in low bandwidth environments. We also learned a lot about creating text for WhatsApp chatbots for women in low literate, low income settings. For example, all text-based content needs to be cognitively tested, including digital terminology, to improve comprehension and recall. Simple conversational language needs to be used, as most of our respondents spoke dialects at home and had a very limited Hindi vocabulary. We recommend working with local scriptwriters who write for populations in Tier 3 cities and small towns to increase comprehension and recall. Having said this, we found that content should be primarily visual, and text should really be reduced to the bare minimum. We also learned some interesting things about grammar. Use the imperative tense for instructional text to improve comprehension and navigability. Don't use punctuation, as the relationship between, for example, colons and bullet points in a list is not really very well understood. And limit the use of emojis, as women's emoji vocabularies is currently pretty limited and can distract or confuse. As I said at the beginning, this has been a gender intentional design project, not a pilot, and we haven't done any evaluative research yet. But what we're seeing from our system generated data and hearing from the digital champions who are reporting back on their work to the self-help group federations is very encouraging. According to our system generated data, 89% of digital champions are using the job aids in self-help group meetings every month, and 74% are using it the required number of times. The digital champions themselves are reporting that more women are attending the self-help group meetings, so they're actually being attracted to the meetings by the digital champion and the content that she's sharing and what she's teaching. They're also reporting that the duration of meetings has doubled because women are staying longer because they're intrigued. And the digital champions are reporting that women are practicing and learning new skills in the meetings. They are asking about and applying for loans to buy phones from the self-help groups. And women are acquiring phones, mostly by persuading family members to gift them their old phones. We're also hearing from the digital champions that the intervention is helping to build their leadership skills, social skills, and digital skills.